Here's what you need to know about antibiotic resistance. I'm Jon Stokes. I'm an assistant professor in the Department of Biochemistry and Biomedical Sciences at McMaster University. At a very high level, antibiotic resistance is the phenomenon whereby antibiotics that typically work to kill bacteria no longer work to kill bacteria because the bacteria that those antibiotics are trying to kill can evade the antibiotic. So the question is, how do we discover new antibiotics faster and less expensively than we have before? One approach that we're using here at McMaster is leveraging artificial intelligence methods. AI can help us by increasing the rate at which we can discover novel chemical matter with antibacterial properties, but also novel chemical matter that is inherently safe for humans. Antibiotic resistance is something that I consider to be an under-discussed pandemic of sorts. So for example, in 2019, roughly 1.3 million people died because of a drug-resistant infection, and no one talks about it. And that number, without immediate action to invent new antimicrobial agents, is projected to expand to 10 million deaths per year by 2050, which is actually not that far away. I'm a believer in the fact that antibiotics uphold the entirety of modern medicine. If you want a new hip or a new knee, or you need an organ transplant, or you need to go on cancer chemotherapy, or you had a preterm birth, all of these sophisticated modern medical procedures only exist and are only routinely practiced because of our ability to control infection. You can practically get your new knee. If the probability of untreatable infection is so high that the risk outweighs the benefit of that new knee, you're not getting the knee. And it's these scenarios me and my folks in my lab are working so hard to avoid. We're always trying to outrun the inevitable evolution of resistance to any new antibacterial agent we discover. Every new antibiotic we discover will inevitably have resistance evolve against it. We always need new antibiotics.